Now, factors that can influence intraocular pressure can be heredity, age, diurnal variation, postural variation, blood pressure, osmotic pressure, drugs, exercise. Also, heartbeat is very important, and respiration. All these, heartbeat and respiration, are very important determinants of, they play a very big role in height of the intraocular pressure. So when I say heredity, I'm talking about races. I already mentioned to you that open angle is common in Caucasians and angle closure is more common in Japanese or people with small eyes. Age is very important determinant. As age increases, the risk of glaucoma can increase. Diurnal variation in intraocular pressure. Usually intraocular pressure is supposed to be highest in the morning. We make use of this diurnal variation to perform this thing called phasing, where we check the intraocular pressure in different parts of the day starting from morning, and we keep checking intraocular pressure to look for this diurnal variation. Postural variation can also be present. It is believed that blood pressure plays a big role in the height of the intraocular pressure. Drugs, certain drugs, sympathomimetic drugs, parasympathetic drugs play a role in increasing and decreasing intraocular pressure respectively. Exercise can, by virtue of heartbeat and respiration, can also determine the intraocular pressure. So now we move on to what we look for. So in patients with glaucoma, we need to look at various parameters, one of which is the fundus. The fundus examination is very, very important in patients with glaucoma, because we see what one of the most important things is CD ratio, that is cup disc ratio. Cup disc ratio normally is about 0.3. So in patients with glaucoma, you expect the cup disc ratio to increase, and that's what I've showed you in this figure. You can see here that the cup disc, this is the cup margin, you can see, and this is the disc. So this cup disc ratio is about 0.3 in this patient, and we will describe this as a patient in which the media is clear, the disc margins appear well defined, and the cup disc ratio is about 0.3. Whereas here, and of course we have to talk about the retinal vessels, the macula, but that's not part of our class today. So I'll be only describing the cup disc ratio. Whereas in this patient, you can see that here also the media is clear, the disc margins are well defined, but the cup disc ratio is slightly increased. So this cup disc ratio is probably about 0.5 to 0.6. Now this is the first thing we have to look for. Next, you also have to look for other features in the cup. So when I say fundus examination in glaucoma, one of the first things that we need to will come into anybody's mind is the cup disc ratio, because of the disparity in the nerves that or the retinal ganglion cells and the axons which contribute the nerve. There is something happening to this neural tissue, which is why the cup disc ratio is increasing. So what are these optic disc changes in glaucoma, and how am I going to document it? The first thing is, always hand drawing is very important. Whenever we see a patient with glaucoma, it is very good to always draw the cup disc ratio. So you will have to draw the cup disc ratio. This is just an example I'm showing you. So right eye and left eye. So just say the cup disc ratio is about 0.7 in this patient, and you're seeing the blood vessels. So this is a regular hand drawing. It is very, very useful for documentation and follow-up. So if this is the picture now, when the patient comes back after about 3 months, if the glaucoma has been controlled, it most probably will remain almost the same. But if the glaucoma has not been controlled, the next visit you may have a picture like this, which also is very good to document. It is also important for us to explain to the patient when he comes that this on the first visit that this is your cup disc ratio. And if he has not been taking his medications, you have to explain to him that it has increased to this much because of non-compliance. So hand drawing plays a big role in follow-up of the patient. The same thing can be done by a fundus photo. This is what you saw. This is a fundus photo of the patient. You're able to document the extent of fundus changes by means of a fundus photo. This is also for documentation and follow-up. We also have advances such as confocal scanning laser topography, optical coherence tomography, and scanning laser polarimetry, all of which will help us to document the extent of cup disc ratio. And optical coherence tomography will tell us about the depth of cup.